Okay. Meniere's disease is a condition that includes a classic trio of symptoms of vertigo, tinnitus, and hearing loss.
Okay.
Episodes are, well, it usually occurs in adults between age 20 and 60. Episodes are called attacks and they can last several days. Um, Although most patients have a window of forewarning when an attack is beginning, others experience what they call as a sudden drop attack, in which the patient falls to the ground with no warning. However, it is known that Meniere's disease is progressive. It leads to an excess of endolymphatic fluid that builds up within the inner ear, causing distortion and distension of the portions of the Lambert system. At first, hearing loss is reversible, but repeated damage to the cochlear from increased fluid pressure can lead to permanent hearing loss. Signs and symptoms include vertigo, which is your dizziness, hearing loss, and tinnitus. Vertigo is often accompanied by nausea, vomiting, headache, and nystagmus, that's your rapid eye movement. Blood pressure, pulse, and respirations may be elevated. Hearing loss occurs first with the low frequency tones. In some patients, it progresses to include all levels and eventually becomes permanent. Patients may describe the tinnitus as having variable pitch and intensity, which may fluctuate and remain continuous. Um, Interventions, non pharmacologic treatment for Meniere's disease includes diet and lifestyle adjustments. For some patients, this condition are sensitive to triggers such as high salt intake, caffeine, your MSGs that are in foods, alcohol, nicotine, stress, and allergens. You want to teach the patient how to modify their diet accordingly. It is also important to teach the client to avoid activities that place them at risk of experiencing vertigo, such as standing on chairs or ladders. Patients with sudden drop attacks should not drive and may be subject to having their driver's license suspended for safety purposes. You want to teach the patients to move their head slowly to prevent worsening of the vertigo. Institute and teach fall precautions to all patients with Meniere's disease. Treatment that is used to reduce the symptoms. Um, Diuretics can be prescribed. Other drugs, such as vestibular suppressants and antiemetics, may be given. Um, when drug therapy is not effective in controlling symptoms or attacks, other procedures may be considered. Decompression or shunting of the endolymphatic sac has been shown to have favorable outcomes in controlling vertigo. And then there's a procedure that they can go in, a surgical procedure that destroys the bony and membranous labyrinth by removal of the neuroepithelial, resulting in total hearing loss on the operative side.